Are you struggling with COVID-like symptoms long after you've had COVID? Emerging research suggests long COVID may be affecting up to 14% of people who have had COVID. Whilst the best thing you can do is rest completely, there are evidence-based natural strategies that can support you in your recovery. Today I'm sharing the emerging research on long COVID and a few of the strategies that I use in my herbal medicine clinic with my patients. Let's get started, shall we?
Well, hello, beautiful people, and welcome to the Project Joyful podcast. I'm your host, Tracy Tutty, your medical herbalist and high performance coach. So, hey, Project Joyful isn't just about being happy. It's about consciously creating a life you love. It's about remembering how to reconnect with your soul-centered joy. You know, that joy that comes from doing what you love, from living on purpose, and from being in a life that allows you to experience deep joy moment by moment. So hey, let's get started, shall we?
Emerging research suggests that between 4% and 14% of New Zealanders who've had COVID have been left with symptoms of long COVID. We're all familiar with the symptoms of COVID, such as a fever, sore throat, cough, muscle or body aches, a loss of taste or smell or diarrhea. And this is known as acute COVID. Researchers have grouped this COVID into one of three symptom clusters for the purposes of research. You get your respiratory symptom cluster, and that's with the cough, sputum, shortness of breath and fever. You get musculoskeletal symptom clusters with muscle aches, pain, joint pain, headache and fatigue, and an enteric system cluster with abdominal pain, vomiting and diarrhea. A COVID symptoms study group has broken these three symptom clusters down further into 6 clusters. So these are flu-like with no fever, so you've got your headache, your loss of smell, your muscle pains, a cough, a sore throat, chest pain, but you've got no fever. Flu-like with a fever, that's where you've got your headache, loss of smell, cough, sore throat, hoarseness, you have the fever and a loss of appetite. Gastrointestinal, this is where you've got a headache, loss of smell, loss of appetite, diarrhea, sore throat, chest pain, no cough. Severe level 1 fatigue, that's your headache, loss of smell, cough, fever, hoarseness, chest pain and fatigue. Severe level 2, that's where you're getting the confusion, headache, loss of smell, loss of appetite, a cough, fever, hoarseness, sore throat, chest pain, fatigue, some confusion and muscle pain. And then severe level 3, abdominal and respiratory. So this is where you've got your headache, your loss of smell, your loss of appetite, cough, fever, hoarseness, sore throat, chest pain, fatigue, confusion, muscle pain, shortness of breath, diarrhea and abdominal pain. The full Monty. Personally, I prefer the 6 clusters as it more closely resembles what I've seen in clinic. Now, whilst immediate recovery can happen within 7 to 10 days, providing you rest completely, symptoms can linger for up to 6 weeks, and the key here is to rest completely. Long COVID or post-COVID syndrome refers to this prevalence of COVID weeks or months after having COVID, even though you're testing negative. And it often has a relapse and remit pattern, so you think you're over it, and then bam, the next week it's back. And because the viral load's no longer there, but you still have the symptoms, researchers are defining this as post-COVID syndrome. Now, they tend to describe long COVID as falling into one of 2 stages. So post-acute COVID, where the symptoms last beyond 3 weeks but less than 12, and chronic COVID is where you have symptoms continuing beyond that 12 weeks from when you had COVID. So while I'm talking about the prevalence in New Zealand, this is a global issue. A report from Italy found that 87% of people who are hospitalised with COVID still had one symptom 60 days after being discharged. And another study found that COVID-19 patients who were discharged had breathlessness and excessive fatigue 3 months after being discharged. Now, you're twice as likely to suffer from long COVID if you're a woman, and you're more likely to have had long COVID if you had 5 or more symptoms during that acute COVID stage. And there's 2 main patterns of symptoms in people with long COVID. The first one is fatigue, headache, upper respiratory complaints, that's your shortness of breath, sore throat, cough and loss of smell, or a multi-system complaint, which is the ongoing fever and gastrointestinal problems. And the most commonly reported symptom is that deep and lasting fatigue. So what can you do to support your recovery if you have long COVID? Like any health condition, it's really important to treat what's found in your body. So support your body in the area where the symptoms have manifested. So what I've seen in clinic, low energy is the most common issue. Doing what we can to support your mitochondria can be really helpful. So consider adding in more antioxidants into your diet. Foods like citrus, berries such as cranberries, blueberries, blackberries, red cabbage, orange capsicum, walnuts, hazelnuts and Brazil nuts. I also use clinical doses of mushrooms such as reishi, shiitake, cordyceps and turkey tail. So as well as supporting mitochondrial function, these mushrooms support your immune system. And some, such as reishi and shiitake, are also antiviral. So from a natural medicine perspective, strengthening the systems of your body which has been affected really helps. Like your respiratory system, think about narrow plantain. Gastrointestinal system, this is where you want your bitters such as berberis. And your nervous system, well, you know I love green oat and skullcap, the Scutellaria lateriflora for this type of work. The amino acid, NAC, N-acetylcysteine, is also helpful. It's an antioxidant, anti-inflammatory and mucolytic. So mucolytics are used to break up mucus where there's too much of it. So it's definitely one to consider if your long COVID has respiratory symptoms. And of course, don't forget your vitamin C, D and zinc compound. It's magic. Now please remember, plant medicine is potent medicine. COVID often requires a bespoke approach. So if you have any underlying health conditions, you're pregnant, you're trying to get pregnant, or you're lactating, or you're taking any medications, don't just rely on the information in this episode. Just because it's natural, it doesn't necessarily mean it's good for you. So please do get individual advice by consulting with your medical herbalist, especially when you're dealing with something as complex as long COVID. Because not only are they trained in which herbs affect a particular health condition or cluster of health conditions, or what's going on in your life right now, but they're also trained in herb-drug interactions and in choosing the herb that is exactly right for you. You see, your body knows exactly what it needs to heal itself, be that herbal, pharmaceutical, food-based, emotion or mind medicine. My job as your herbalist is to connect you with the herbs your body is already searching for. Now, long COVID is a condition that's best approached with the support of a health professional, so please do reach out for help. As an executive coach and medical herbalist, I integrate these health protocols into my coaching sessions to ensure my clients not only lead effectively, but also maintain their well-being. And this holistic approach helps managers, executives and professionals stay at their peak performance, even during those challenging times. Sending you lots of love. Bye for now.
Hey, thanks for listening to today's podcast. Can I ask you a favour? If our conversation spoke to you today, could you please take a moment to leave a 5-star review? Your review will help people discover this podcast, and together we can create a world where there's even more love and more laughter. And if you want to hear more from the Project Joyful podcast, just click the subscribe button. Bye for now.